Hi, my name is Paul Gill, and I work here in health promotion in the HSE. I'm based in Merlin Park in Galway, and you're welcome to session B of our chair-based physical activity session. These particular activities are designed to support staff who are participating in the Move More at Work programme. This particular programme aims to support staff to reduce sedentary behaviour and indeed excessive sitting, and to integrate more physical activity into their daily life. We focus really on four kind of key areas as part of that programme. One is to lift it, shift it, move it and improve it. It's not only for people participating in that particular programme, it's for any HSE staff member who would like to avail of this particular session, or indeed our partners are more than welcome to participate and to avail of this session also. The idea really is that I will show the activity from the chair, and then it's up to you to engage in the number of repetitions that you would like to engage in. So that depends on how you feel in terms of your fitness level and in terms of how you feel that particular day. What we would say, I suppose, is to try to build up to 30 minutes of activity a day, over 5 days a week, over the course of the week or whatever. But you know what? If you can't get there or don't have the time to do that yet, my motto is go from nothing to something. Build it up incrementally over time. And as part of that, I would say pay attention to any limitations you might have in terms of neck pain, in terms of back pain, in terms of shoulder pain, knees, hips, whatever you feel might limit or cause you any pain. You just mind yourself and kind of go at your own pace. And the last kind of thing of concern that I would say to you is please choose a chair without any casters, so that will ensure your safety throughout the programme. So enjoy it, and I hope you find it useful. Thank you. So we'll keep the hands down by our side again, and we're just going to bring the shoulders up and just rotate them forward, the forward position, just up, rotate forward, and again that just loosens out all that upper body there. Then related to that, we're just going to imagine that you're in the pool. So just do a swimming stroke, just come forward, bring the hands up and forward. I know somebody will criticise my swimming stroke, but just try to simulate what you think is a good swimming stroke. Just go like that, nice and gently, and come forward and relax. Okay, so just going to focus on our back now, and I would be saying this too, it's important to be mindful, particularly if you have a bit of low back pain, but at the same time it's important to try and strengthen your back. And a good way of actually trying to eliminate back pain when you're doing this exercise is keep your chin parallel to the floor. So place your two hands on your knees, just come forward, but your head is up, chin parallel to the floor, and push off the knees. Come down, chin parallel to the floor, push off the knees. Come down and push up, and come down and push up. The next one, I just want you to imagine that you are doing a solo. You're in Wembley Stadium, people are screaming out your name, you're doing your solo piece on the piano, but I want you to imagine now it's a circular keyboard. So you're just moving to the right and left, and right and left, and gently try to make the high notes. So you're turning right and left. Just increases a bit of mobility there in the lower back, up and down, and up and down. Back to the centre. And just another additional piece for the back. Just make sure your back is supported again against the back of the chair. Just hands down by your side and just gently bend down to the right, centre and left, centre, right, centre and left. So you're reaching for something in your handbag, then down, centre and back up, right, centre and back. Okay, this time we're just going to focus on a little bit of cardiovascular activity, believe it or not, from the chair. When we say cardiovascular, you're introducing kind of the heart and lungs. So there are three things that will happen. Your breathing will increase, your body temperature will increase, and your heart rate will increase. So that's all normal. There are the three kind of body clocks that happen once we do a bit of cardiovascular activity. And we all know that cardiovascular activity is hugely important for our physical health as well as mental health. So just to show you, I just want you to imagine that you're walking in your chair. So just imagine, so I just want you to lift the legs up, swing the hands just beside you, and if someone is passing your door, ignore them. Just keep going, just lift the legs and lift the cheeks of the bum off the chair. Just lift the legs, lift the cheeks of the bum off the chair, and now just make an effort to come out to the edge of the chair, and we'll use a hip hitch to go back. Back out, and back. And this is the importance of having a chair without any legs, because you don't want the seat rolling underneath you. So you just come out to the edge and back. So you just keep walking. And just another variation is just to walk around your chair. Just walking to the right and the left center again, and left, and the center. And now we're just going to introduce another variation. Right leg out, left leg out. Right, left, right, left, right, left, right, left, right, left, right, and left. And then just gently touching the knee. Right leg, left, right leg. And then the more proficient you get, you might be able to just bring the leg up sufficiently to clap underneath them. And relax. So now again we're just going to go back and do an activity for our triceps here. They're a little bit more difficult, but two variations. One is an easy exercise, and then one is we just adapted to make it a little bit more difficult for us. So they're called tricep dips. So just place the heels of your hand, like before, on the edge of our chair. Just walk out with the 2 feet. Keep your legs bent, and then just gently lower your bum to the floor. Bend the arms and straighten. Bend the arms and straighten. Bend and straighten. And just come back and sit down. Then just to make them a little bit more difficult, where you're carrying a bit more weight on your triceps, just extend the hands, rest on your heels. Then you just lower the body, bend the arms, and come up. Bend the arms and come up. Bend the arms and come up. And then just gently, for safety, walk back in gradually. Place your bum on the seat and you're home. Okay, so now we're just going to focus, believe it or not, on our calves. Small little muscles down here, the lower part of the leg, but crucially important. And particularly, strengthening the calves is important because there's a little pump down here called the soleus, which is hugely important for venous blood flow and returning venous blood back to the heart. So all we're going to do simply, again maintaining our strong base, just come up onto the toes and tighten your calves as you do that. Just come up onto the toes, tighten your calves and back down. Come up onto the toes, tighten your calves and back down. We'll just add in a little variation. Come up onto the toes, push out and pull and down. Come up onto the toes, push out and pull and back down. Come up onto the toes, push out and pull and back down. Okay, and we're back now to focus on the main muscles here on the upper leg, the quadriceps, 4 muscles here. It's important again to keep these strong, and a very simple exercise we can do at work is very simply just to go from sitting position to standing, pressing through the floor. So just press through the floor, come up and stand up and just squeeze the buttocks at the top of that. These muscles here are hugely important for supporting the lower back and the back of the upper body. And then just sit down slowly. And again, just pushing through the floor, come up, squeeze the buttocks and back down. Sitting down slowly. And come up, push through the floor, squeeze the buttocks at the top, and then just slowly sitting down. We're just going to add a variation to that, a slight variation, pushing through the floor, squeeze the buttocks, come up onto the toes, lower the heels, and sit down slowly. Push through the floor, squeeze the buttocks, come up onto the toes, lower the heels, and sit down slowly. Last time, I'm just pushing through the floor, come up, squeeze the buttocks, come up onto the toes, lower the heels, and sit down slowly. And relax. Okay, I'm just going to show you 1 or 2 exercises again now that you can do from a seated position in your chair, which focus mainly on definition. But what's critical here is that you breathe out all the time when you're doing these, because sometimes it can lead to a bit of pressure on your heart if you don't breathe out. They're called isometric exercises, which means they're static. There's no movement, shortening and lengthening of the muscle. It's just static, but it does increase a little bit of pressure on the heart. But to alleviate that pressure, just breathe out. So very simply, just place your 2 hands together in front of your body, place them together like so, and just squeeze. But continue to breathe out, breathe out. That's why I'm going to talk now for most of these. And you'll feel the definition right across your chest and your arms. Just squeezing there, but by talking it ensures that you're breathing. So nice and gently, just press against each other and relax. And then you can vary the angle by pressing down. You're just targeting a different part of the muscles in the upper body. But again, the critical thing is to breathe out, breathe out, breathe out. So if you're good at singing, sing, breathe out, and you can feel the definition there in your hands, and relax. And similarly, we'll go up, just kind of up in front of your forehead, just pressing again, the two hands pressing against each other. You're just targeting a different aspect of the muscle, but it increases definition there. And relax. Come back. Very good. So the next one that we're going to do is we're going to interlock the fingers this way. Something similar. So interlock the fingers and then pull. So again, static contraction, but please breathe out. You feel the definition all along here in the shoulders, building up here. So interlock the fingers and just pull. Just pull. Yeah, breathe out. Don't be afraid to breathe out. You'll feel it. You can feel that in your chest muscles as well, all across your upper body, right across the back of the arms. Very, very good. But again, critically, breathe out, breathe out, breathe out, and relax. And the last one I'm just going to show you is very simply just putting your left fist over your right and similarly pushing down with the left, up with the right. And again, but just breathe. Nice and gently, and again, these are more or less for the shoulders. Just to breathe out, breathe out, breathe out, and just alternate, right on top, left at the bottom, down with the right, up with the left, and breathe. You'll feel your body temperature increasing as you do this, but by talking, you'll certainly ensure that you're breathing, and that's critical. And relax, and come back. Well done. Folks, thank you very much. They're just a few activities that we have shown you. Again, activities from the chair. Again, the idea being to integrate activity into your daily life, particularly by moving more at work to reduce sitting time, as we have said at the outset. But listen, my motto is, don't be hard on yourself. Just go from nothing to something. The fitter you are, or when your fitness improves, your capabilities will improve, the number of repetitions will improve, the more comfort and more ease you will find in doing them. So don't be hard on yourself, give yourself that time, and it will happen. But listen, we would love to know what you think and your feedback, so if you wouldn't mind, you can let us know what you think of the activities and how you found them, and you can drop a line to paul.gillen@hse.ie. And we'll be delighted to get your feedback, because listen, we're always trying to improve, and I know we can improve this, but we'd love to hear from you. Folks, thank you so much for participating. I hope you enjoyed them, and more importantly, I hope you feel better because of it.